So we saw some of the features, which I think that despite the absence of subtitles, people can tell that this was an active physician community in France.
Yes.
Yes, I wanted to ask you, how is it that Merck, we've been saying a lot here that that Merck is a pharmaceutical company, and that the pharmaceutical industry is not quick to get into physician portals and communities, and yet that's not true with respect to Univadis and Comuniti. So tell us why you think that's the case.
Yes, Denise, exactly. First of all, thank you very much for giving me the opportunity to talk about Comuniti, which is, I think, a breakthrough service provided by a pharmaceutical company today. It's a pilot, as you say, which we are leading here in France. But just before talking specifically about Comuniti, I would like to go back to Univadis to explain to you why we are doing that today. So Univadis is a service provided by MSD or Merck in the US, which is provided to more than 2.5 million healthcare professionals around the world, and in more than 40 countries today. In France, there are more than 180 healthcare professionals using it regularly, and our idea behind Comuniti was to move from a 1.0 website, very top-down website, where we are providing content to the physicians, content they need, they are using, that is very useful. But we thought we missed something, and we thought we missed the 2.0 evolution, because they access to all this content on Univadis, but they don't have access to something that is, I think, very important, is the knowledge and the possibility to share with each other, because they are using the same platform, but they were not able to share with each other or to discuss topics. So what we did with Comuniti is to create a platform that is answering these needs. But I'm going to be very honest with you. At the very beginning of this project, it's been very tough. Concretely, Comuniti is not only about social media, but is about creating a social network and doing it when you are representing a pharmaceutical company. So it's been complicated internally, but it was a great challenge to share with all the people involved with this project. All this team of, as you know, we have regulatory constraints that are complicated in the pharmaceutical company. So I worked together with the medical, the regulatory team, the legal, and we worked together to understood how we could do that in the proper way. And I think there are more solutions than there are risks. And this is something we need to retain in our minds, is that even if we are a pharmaceutical company, we can do things and we can provide services to our customers and to the healthcare professionals to help them better take care of their patients.
But how did you get that first decision? Yes, we're going to be the first one to go with a physician community. How did you get that decision to be taken?
So we get it by doing multiple workshops internally, and at the end of the day, we thought that we had more advantages, if you want, to do that, because we want, MSD wants to provide services to healthcare professionals. And so we want to be the pioneers in this domain. So we decided that it was a good move to go there, compared to the risks that we saw that were very limited at the end of the day.
And how do the physicians react with the fact that this community is being financed by a pharmaceutical company?
Yes, this is a very interesting question, because I think we don't really have this issue with Comuniti and with MSD. I mean, the chance we have, in a way, is that we built a strong brand. And Univadis, it's not a campaign, it's not something we're doing in a one-shot manner. It's clearly a long-term investment of a pharmaceutical company. Univadis in France exists since more than 10 years. And so we built trust around this brand, and we show to the healthcare professionals that a pharmaceutical company can add value by bringing services that are medical informations, ECME modules, so these are the main content that they are using, drug database access, through a service like Univadis, which is content coming from other companies that are providing them. We are doing partnerships with The Lancet, BMG, and JAMA, for example, which are trusted brands as well. And so the model is all around trust. And so for Comuniti, we don't have this issue because the physicians and the healthcare professionals that are using it are already very at ease with the usage of such a service on Univadis.
Okay, so I'm going to ask one more question, which is, do you feel there's any particular profile of physician who is more likely to start right away whenever you come by with a new service like Comuniti?
Yes, of course. Of course, and the first ones, the early adopters, are here probably in this room, but also other physicians or healthcare professionals that are geeks or that are very interested in sharing content. But one very interesting thing I would like to share with you is that when we started working on this project, we had no feedback from any healthcare professionals or doctor coming to us saying, Thibaud, I really need a social network. No one. But what they do need, is to be able to share files, to share content, to share patient cases, and to ask questions, medical questions to their peers, because they need answers, because they want to regroup in groups, in virtual groups, and be able to share content with each other, and so on. So their needs are not a social network, but this is the solution we found for them.
Thank you very much, Thibaud. I'm
Thank you,
going
Denise.
to thank you.